Meniscus injuries. Meniscus are of two types, medial and lateral. Hello, I'm Dr. Mohit Arora. I'm working as a consultant orthopedic surgeon in Gurgaon. So basically in this video, I'll be talking about meniscus injuries. Meniscus is a basic C type of cartilage structure present in the knee joint which act as a shock absorber. Now meniscus injuries are, they have a different cause and different subset of patient. In younger patient, they're mostly because of involvement in athletic activity, and in older patient, they are mostly degenerative tear as a part of degeneration of the knee joint. Hence, the management is very much different in both the subset of the patients. Now, in young groups who are involved in athletic activity, there is basically involvement in high impact sports like basketball, like cricket, like tennis, where there is a pivoting of the knee joint, thereby leading to twisting injury of the knee joint, and thereby leading to meniscus tears. Meniscus are of two types, medial and lateral. Medial is present on the inside of the knee joint, and lateral meniscus is present on the outer side of the knee joint. So whenever a patient presents to us with a meniscus injury, we examine the patient. There is sometimes swelling in the knee joint. The most characteristic finding in a meniscus injury is medial joint tenderness, specifically in a medial meniscus patient, or a lateral joint line tenderness in a lateral meniscus tear. Now, as far as diagnosis is concerned, it's clinical supported by a radiographic examination like X-rays and MRI to be very specific. MRI will tell you the severity of meniscus injury and the the type of meniscus which is torn. Now, if these things happen in an older age group of patient, usually there is not much of a severe significant twisting injury. Sometimes they just happen because of degeneration of the knee joint. Well, we will discuss the management of meniscus tear in both the subsets of patients differently. So coming over to the younger patients, the meniscus tears are classified into grade 1, 2 and 3. So 1 and 2, up to 2 grades, they can be managed by conservative mean, which is, giving them rest, knee brace, icing, analgesics, elevating their limbs, and restricting the activity which actually led to these meniscus tears. Now coming over to the grade 3 tears, specifically complex tears like bucket handle tear or vertical or longitudinal tears, the tears which are repairable like peripheral tears because of the high vascularity, we try to repair them, and sometimes the tears which are not repairable, we do take them out by arthroscopic means. So the surgical procedure would be arthroscopic meniscus repair or meniscectomy, wherein we take out the chunk of the torn meniscus. Now the indication to undergo surgery is whenever the pain is not subsiding even with conservative means for at least 6 weeks, and there is a locking of the knee joint in the sense that patient is not able to actively extend the knee, because meniscus once torn, sometimes it can float in the knee joint as a loose body, or sometimes it gets stuck between the femur and the tibia, thereby leading to locking of the knee movement. So in that case, we have to take the meniscus out. Now coming over to the meniscus injuries in the older group, we tend to manage them conservatively like in adults, and there is another option of giving a platelet rich plasma injection to accelerate the healing of the meniscus, wherein we take the patient's own blood, we separate the platelet rich plasma which is very rich in growth factors, and we inject that into the knee joint. So that can be done in both younger and older age group. Younger age group wherein we are not planning to do surgery, and in older age group where the surgery is usually not required. So this accelerates the healing of the meniscus, thereby relieving the patients of its symptoms. Now after you give them injection, you do a rehabilitation program, you teach them the exercises, you teach them how to strengthen their quadriceps and hamstrings muscles. So this whole thing will help them get over with the meniscus injuries, and in younger patients they can go back to sports after doing all these treatment and management. Thank you.